demonstrate how to do a head wrap for a patient with a cochlear implant before he goes for an MRI scan. This is basically to stabilize the magnet. So what we need, we use the hearing aid mold material to make a dummy mold like this, so as to put it on top of where the receiver stimulator package sits. So I'm going to demonstrate how to make the mold first. So we're using a Steramold ear impression material. So you take 1 scoop of this, which is usually enough, and just take it on your hand. And there is a same Steramold hardening material, so you need that. So just make it into a little disc and then flatten it out and just make a little impression and put some kind of a bit of the hardening material. That should be enough. And then keep mixing it. It's a bit oily. It'll just all take a few seconds to mix it, like mixing a dough. And once it's all mixed nicely, you can just make it like a little ball and then flatten it out on a flat surface. So you need it to be of the size of the disc of the receiver stimulator package. And wait, it takes about a couple of minutes to set. And if you keep it thick, it should be enough to actually help hold the magnet in place. Okay, now I'll demonstrate one with a ready, already hardened mold material. So this is how an external processor sits in the patient. What you want to do initially is mark where the external processor is, so that you know where the magnet will be sitting. So the magnet usually sits in the center here. So you want to hold on to that and make a little mark on where the external processor is sitting. And just make a little, so the center, that's where the magnet will be sitting. So your implant, the mold that you have created should be actually centered around this. Okay, and then you use one of the crepe bandages, which will hold this material in place tight enough. Thank you very much. So you can ask the patient to hold that whilst you're having free hands to put the first wrap. And you want it tight. The patient may feel uncomfortable with it for a few minutes as when they're having the MRI, but that is essential so that the magnet inside is actually stable. And you just roll. So as you complete each rotation, you just give a little stretch so it's kind of tight enough before you go on to the next one. Okay. And then in the end, just secure it with some micropore or steri strip or tapes like that. And then the patient goes in through the scanner. That should be fine. So this is one where I used the material for implants, which will be either MEDEL or cochlear nucleus device. For an AB cochlear implant, you need an MRI antenna coil cover instead of the mold material that we've used. So this coil cover has a flat end like that, which will sit on where the magnet is, and a well which should be on the other surface, of course. So if I can demonstrate here, that's the center of the magnet, where center of the processor where the magnet will be sitting. So you want the antenna coil cover with the flat end where the magnet is opposing in this manner. And then you do the same thing. You actually just do the head wrap with this in place. So in this case, you don't need the hearing aid mold that we used to create the disc. And then again, you have to be careful that the coil is not shifting whilst you're doing your wrap, which is most important, otherwise the magnet is not stable. And again, just a few wraps around, just for it to be tight and all the way through. And again, secure this with micropore or stab tapes like that.